Dear viewer, welcome to Gaza Media. These are all images from last 3 years health campaign that took place in Chang. And today, March 12th, the event is being broadcast live from Mary Health of Africa Hospital, where the health campaign is currently going on. Let me play a clip of this whole report from last 3 years for our viewers. Let me see if I can take out the volume here. Play.
Continue for the way where they do, and so God will put more effort for them. They will continue for the bless them.
For Gaza Media, I am Gillette Atem.
Okay, that was kind of an old report that we did
The
last time.
3 days medical mission for internally displaced persons, organized by LECUDO-USA and partners, started today, 20th of March 2023 in Chang at Fianga Polyclinic, and a multitude of internally displaced persons from across the country responded early this morning to benefit from these free medical services. Some beneficiaries recounted what brought them there.
We're here to consult free consultation from US, LECUDO. We've got the register our names, got our numbers, and we're waiting.
Here today because I don't hear say free consultation day, so my eye don't over worry me. I don't go sit arrange from Kongsamba, so I be here this hospital. So before I say no, me too I try come and see them. I know say even now waiting they must tell me my eye must go because if not be na this war, I don't forget this serious problem. If I go there for my house, I don't forget this problem.
They equally appreciated this initiative by LECUDO-USA and partners.
This is not their first time. Last year or so, we were here. This year again, we are still here. And we do appreciate so much and pray that God who have brought them here will take them back to their residence.
They start tying them plenty. Because money we are all spend and from Samba for this my eye. And for year, they want work for me free. So I thank God for the free consultation where they get. And I beg God say may they continue for the way where they do, and so God will put more effort for them. They will continue for the bless them.
For Gaza Media, I am Gillette Atemke. The 3 days medical mission
As you have been listening, that was a report that we did 3 years ago where the health campaign actually started. Like I said, today we are at Mary Health of African Hospital in Vo, where we'll be bringing live images where our reporter is on the ground. So stay put to us, share the link to a wider audience so that people can listen and have first class information of what is happening right now, presently. And the time now is 9:28 Eastern Standard Time here in the US, and in Cameroon, I believe it's around 2, uh, maybe 1:28 or 2:28. I don't know the exact time, local time now. But let me switch the screen. Let me bring in Mary, and so that we can talk and say, yeah, Mary, you are welcome.
Thank you very much, Director.
Yes, Mary, yeah, I see that you are here. There are live images behind you. So can you just give us a little bit of what is happening right now?
Yes, sir. Yes, Director, like you rightly said, today is the day two of this free health campaign organized by the Focolare movement, Mary Health of Africa Hospital Fontem, LECUDO-USA, and other partners. And right behind me are the population, the people who have come to benefit from this free health campaign. They have been here since 6 a.m. and they are still here receiving treatment, consultation, eye care, dental care, and mental health services. The population has reduced because it is already afternoon and it's nearing evening, and the time is currently 2:29.
Oh, according to what happened, it actually started yesterday. Can you briefly tell us how yesterday was like? I know we're not able to come on because you have a very busy schedule yesterday. How was it yesterday? How do you feel like the delivery, the outpour of the people yesterday, given the fact that this kind of treatment is free? You know, people like free stuff.
I must say, the number of persons that turned out for this campaign yesterday was really impressive, encouraging for the organizers, because from the turnout, you can really say that life is is gradually returning to this divisional headquarter Menji, why not Libya Alem as a whole. And yesterday, they succeeded in registering a total number of 447 persons, and among those people, there were dental patients. There were those that went for dental care, those that went for eye care. And as you know, uh, vision problems is the most sought out issue here in Lebialem, precisely here in Fontem. And like I said, they were able to register up to 449 persons, and among these persons, from the war, people from other parts. And this free health campaign was not being paid for by the patients. They received it free out of kindness from the organizers.
This is not the first time you've been to Fontem. You've been to Fontem for different events. I think this is almost the second time that you are coming here for the hair campaign. The first time you came and reported for the hair campaign, when you compare what you did previously, or the outpour, the environment, the activities, the road from Chang to Menji, is there any difference in your own experience?
I was hoping to talk on this particular aspect because I personally climbed the motorbike so that I could gain the experience and be able to make a good comparison from the road from Lewa right down to the Maria Police Center. I noticed a big difference compared to the previous years, or let's say compared to last year. The road has been graded and the pathway is more smooth compared to last year. I equally noticed something I was really impressed about, which is the street lights. I reached here in Fontem at past 7. That was on Tuesday, past 7 p.m. And on my way here, I noticed that they had street lights. And when I spoke to the CEO of LECUDO-USA, he told me that that was a project that is a contribution from those in that particular area. I saw street lights around Seed of Wisdom College, before the Seed of Wisdom College, and I saw, I think, about a total of 9 streetlights, and I must say it's really impressive. Now, speaking about the road, I said the road was really smooth, which means that my journey was even smoother, and I enjoyed the ride here. Although the doors been graded, and compared to before, it's way more better.
One other thing that I wanted to find out from you, you said the smooth road. You mentioned from the wall down to this place. What about from a law area coming down to the wall, or from Chang itself? Because when you leave Chang, you pass through Fongu Tungong. After Fongu Tungong is a law around the Telecon, and then from a law you come down to the wall. How is the road? Do you see any differences in different stretches of road?
Yes, the last time I was here, uh, the road from Chang right down to
Yeah, it's routed.
Lewo or right down to Alo. They,
Uh-huh.
yeah, from
The one
Chang to Alo.
you
They
just
had
joined
started
one
the
of
they had
this.
started the road grading.
That means tell maybe
Yes, they had started the road grading. So I so so they just continued the process
yeah, no, join online now.
from
Join
Alo
online.
right down to here in the back.
Yeah, join. When we reach here, before I take you in, you will see. Yeah, I got it online now. Yes, sorry, Mary. Yes, I
So I
was
can say
interrupted with
that there
another
has
call
really
when you are
been.
here are coming in from left and right and started that. I think right now the people are still coming there. I think I just wanted to talk us to discuss a little bit before you can maybe take the camera a little bit closer so that we can talk to some of the health professionals. Is there any way you could bring some of the people to camera, some of the residents so that I could talk to them? So that I could ask them any question?
Here, okay, here at the gate, I'm a bit far from the hospital residence itself, but
Mhm.
beside me is the CEO of LECUDO-USA. Sir, please. And we're just going to hear some few words from him about the campaign and the turnout of the people.
Yes,
Thank
just
you.
ask him
Thank
because yes,
you. We
ask
are
him because
here
maybe he may not
because
hear
of
me. Go ahead
African Day
and
of God.
conduct. I'm listening.
And the turnout today, although it's not like of yesterday, but we still have a huge turnout. A huge turnout. A lot of people starting from kids, adults, and parents are here today. And we have doctors, mental health, general medicine, dental, um, eye care, surgery department. Our parents are so excited. And so yesterday we registered um, 11 surgery and consulted more than 25 mental health patients. And as of last night report, we consulted more than and, and 500 patients yesterday. And today, although it is not as huge as yesterday, but we are looking at higher 300 for today. Thank you.
Sir, please, can you tell our audience maybe a word to all those who are still reluctant to come and benefit from this free health campaign?
Thank you. As of yesterday, the non-LBLM were here, and this campaign, these services are provided free. Those that are reluctant to come for the campaign, to borders. You do border all the surgery that we mentioned out of charge. And we will record that no surgery, and if you can gain those services for free of charge, it's really benefit for you as a patient and then for us as the community. Crisis and mental health is another department that we also focus very much into. And please, we are calling on all our people, go and tell your neighbor that free health campaign will go another day tomorrow, full day tomorrow, so that they can come and benefit. Medications are for free, and 90 days follow-up medications as well as for free.
Now, Mr. CEO, we know it is still too early to ask you how you feel seeing this number of persons turn out for this campaign. And we still want you to talk about it.
Sincerely, as of last year, we have seen a whole huge population here. We feel like our people are really believing in this cause. They are really believing in this project, and that was our goal. We want them to know that health is life, because without being healthy, you cannot do anything uh, possible. So the feeling that we feel this year, the feeling as of yesterday is great, and we really want our people to feel that way. We really want our people to be healthy. We really want our people to know that health care is the primary for your health, because without being healthy, you cannot do anything sustainable. So please spread the word. Please know that every year the LECUDO-USA will be here. The LECUDO-USA and the partners will be here. So we are so grateful that they have started to see the benefit of this health campaign.
Thank you very much,
Thank you,
Mr.
Sue.
CEO.
Thank you so much.
Yes. Yes, Mary,
As you have heard from
thank
the
you, and
CEO,
thank you.
director, and televiewers, the turnout is really encouraging to those who contributed for this campaign.
Yes, okay. Yeah, Mary, thank you so much for that interview. I think while you move the camera a little bit up, I want to bring in one of the panel, Live Bridge International. He's also joining from the studio from somewhere else in the US, so that we'll have some conversation. But while you and the camera person can move a little bit, maybe towards where there are other personnel, so that we can conduct an interview. Let me bring in, dear viewers, let me bring in Dr. Inqueta Richard, or Dr. Richard Inqueta of Light Bridge International, as most people know him. He has been at the forefront. He was like kind of the first people, the very first people that went to Cameroon, and at that time it was in Chang. Dr. Richard, you now see what is happening. You are looking at live images. You are looking at my reporter right there in Fontem. I mean, this has long like something that maybe you aspire. It will usually be in Chang. Seeing it now in Fontem, what are your impressions so far? Uh, yeah, it appears that your microphone, no, your microphone is on where I cannot hear you. Okay, yes, why he tried to work on the sound system. Mary, let's move our camera closer to maybe closer to the hospital itself. Uh, Maybe where you could pull some of the other uh, personnel, people like I think Dr. Christella. Uh, then yes,
Can
and
you hear
then
me?
yes, Dr. Richard.
Yes, can you hear me?
Yes, I can hear you now properly. So
Okay.
I was asking you like you seeing live images now, something that you've been to Cameroon. It was in Chang for several years, and now you are seeing it here in Maryhead of Africa Hospital, your own place of birth. Had any reaction?
Um, I think what I would say is it really gives me joy, right, to see that this medical campaign has moved from Chang, which is not our place of origin, to Mary Health of Africa Hospital. And that is the hospital where I was born. And so it really gives me joy to see that this campaign has moved to its rightful place. And it's unfortunate that I could not be a part of it this year because I had some really personal family matters that just preoccupied me. I lost my elder brother. And so I could not be a part of it this year. But I'm hoping that, with subsequent campaigns and with the peace returning in the BLM in Fontem, that we able to make it there next year and expand
I
more
want
on the
to talk some smart for
campaign.
come on.
And so also,
Thank
with every campaign,
thank the
there's
people that
always
organize this campaign.
that opportunity to to do a reassessment and see what it is that when we're where can we improve, and so we keep improving. So, and I really want to send a message of appreciation, to the professionals that are on the ground from here, every volunteer, every contributor, every sponsor. I want to
Hmm.
give that words of appreciation and say the Lord will continue to replenish those sources. And those volunteers that left from here, that left from wherever they came from, that as they provide those community services, the Lord will be with them and will take them back safely. And we can just, they say when you get to a certain stage in life, you want to look back and see how you can give back to the community. And there's no joy that is greater than giving back, to your community, especially when something like health, which is a basic human need. But unfortunately, our region, those needs are hard to be provided. But when you have sponsors that can come up and provide those services for free, I think it's really great. So I'm excited seeing what I'm seeing. And I just want to still say thank you to all the sponsors. And let's continue to do what we can do to help
Yes,
our nation.
yes, Dr. Richard, I'm glad hearing this from you that you are still very more involved. I think the images are a little bit kind of shaking. I think it's because of the internet issue. I think Mary was trying to get to somebody, but until we have a good audio where Mary can hear me or where we can hear her properly. Uh, Dr. Richard, there was an area, I think this is your expertise. They were talking about mental health. Before you came in, I think the CEO was analyzing that. That's an area that they are focusing on because they have discovered that there are a lot of mental people around, even in our own area, especially from this post-trauma kind of crisis that has been ongoing for several years that we all know about. Uh, is that something that you, with your team, with other colleagues of yours, like Dr. Bella, where you do you think that you can come on maybe in the future with some concrete program that can be actually be implemented?
Yeah, I think as far as mental health is concerned, I'm really happy that Dr. Kembala is on the ground and she's providing those services, because mental health, as you know, is one of those areas where there has been a lot of stigma attached to it, where people who have a mental health disorder and there is that resentment in the community, or they are scared of seeking help. But I think as we go about educating people and providing those services, and then people get to see the outcome of it, they themselves will begin to understand that mental health disorder is just as any other medical disorder which needs treatment. So as far as next year, I am, like I said, it's unfortunate I could not participate in this
Yeah.
year's, but God willing, right? Next year, I would really be on board. I will be talking with Dr. Bele and other mental health professionals, as well as the team in general, to see how we can improve on the mental health services. And also, I did my DNP project was on telehealth. So that is an area where I'm looking at trying to see how we can improve access, because telehealth will help improve access. It has been proven that it helps improve access and it's more cost effective. So that's one area where we can explore, to be able
Mhm.
to provide those mental health services even beyond the period of the medical mission.
Yeah.
So that's something I'm discussing with the team and Dr. Bellet, so we can expand on it and make that mental health more accessible to people.
Yes, I remember like I mean this we went off camera a little bit from down, but the image that you see here on the screen too are also images from last year. Not last year, maybe last 3 years when you people were in Chang and looking at the evolution of the medical LECUDO-USA medical mission as they call it. In, looking at how it has evolved bringing in expertise. Like you at that time, I think it was only you and Dr. Ekobe. Yeah, I think maybe later on Dr. Christella. The people start coming in. Look at how it begin to grow. Then Dr. Bella to all of them. You know, this team of expertise now it has extend to vision care. Why not dental care? Then you know, with all of this, I think it is a wonderful thing. I think I also lost Dr. Richard live image, and it's been a wonderful event. But again, this is currently happening down in on the ground in Mary Health of Africa Hospital, Fontem, located in Ver, where the Focolare movement, which own the organization, and the hospital, together with the LECUDO-USA and other partner, are organizing this particular event. I think we'll have some live images now coming in from the ground. Maybe let me get back to Mary and see if she's able to now explain to us exactly what is happening right now. Um, um, yes. Uh, Mary, I can hear you, or I can receive now audio from you. So, yes, I think, yes, over to you. Can you hear me now? Okay, let me do this. Mary, can you hear me? Having a lot of network connectivity. Please just bear with us. Yeah, we will try as much as possible. It's still challenging having good network connectivity, especially from home. But like I said, this is a wonderful program that initiated a program that was initiated under the leadership of Terence Atem, CEO Emeritus, uh, to provide care to our vulnerable population, especially during that period of the crisis where a lot of people from the BLM, people from the Bang were internally displaced and to the western region, especially in Chang. And yeah, Mary is back here. So, Mary, can you ask her, can you hear me in the first place? Okay, yes, Mary is still having a issue with. I think Dr. Richard too is trying to connect back. Like I was saying, the program was
Health of
designed
Africa
initially,
Hospital.
Yes,
but
welcome
by
to a very time when I plenty because I don't time doing fine.
Okay. Can you tell the camera how you had
The people are here for phone. They send for WhatsApp, say when I become work for you for marry her here. Then I make a camp. I rate tank when I 14 when I do for camp help with because for we say here will not be get hospital. All places, all things is scattered will not be get better hospital where they feed the work for we. If I as for wrong time for help we should be correct. If
from?
I come for Bisali.
Okay.
to talk about it. Yes, Dr. Richard, before the line disrupted us, we were talking about, something like this mental health issue is something that we were not used to growing up. But as time goes on, you see, uh,
Did you come here yesterday or is just a doctor?
No.
Okay. They'll attend to you very soon.
Okay.
Okay. Thank you very much.
Thank you too. May God bless.
Amen.
yeah, I just want us to have for Mary to have.
As you just heard from a beneficiary, although she has not yet seen the doctor, but she has come.
Okay, yeah, okay, Mary. Thank you so much for the wonderful coverage that you are for the wonderful work and wonderful coverage that you are doing today. I think today our internet connectivity is not the best. Other time we used to have very good steady connectivity. Maybe when you are close to the building, maybe the link or the signal is not very good. Yeah, Mary, thank you. I will let you go for now. Let me remain here and talk and discuss a little bit with Dr. Richard, one of the pioneer a volunteer for this program. Not just a volunteer, but also a sponsor, somebody who has sponsored through his organization or the family organization, Life Bridge International, a well-known organization that started way back. I think where they have even been providing food and basic item to less privileged right from Douala and Limbe, even proud to the crisis even. I guess so. Mary, do you have any other thing again so that before we let you go, the network is not the best? Yes, Dr. Richard, I know with the library, you want to give a little bit of background about the library, how you started your involvement and your relationship. I know there's a lot of things that you did because you even sponsor beyond the hair campaign. You also sponsor the insurance scheme that was run by the Kudu USA for some time to
For
give
LME,
free
take back
medication
LME.
to people that
No, they could attend to you small time.
were
Come
coming to the hospital during that the peak of the crisis.
No, they could attend to you.
Yeah, Dr. Ernest. So, LifeBridge started, I think, we initially started in 2019, and then we did some food distribution in Douala,
The program now, they go get full
Kudo Hall in Douala. Then we move on to the medical missions in Chang,
pay
and
some
I
people, then
think
they
we've
go
done
come.
that
The thing go continue.
for how many years? We did it successively for I think about 3 years, and but unfortunately, like I said, this year I could not be a part of it because of a family crisis that I had. But we still look up to future medical missions as well as
Is this one that is
expanding
talking about?
the program. Contributing ideas that will help expand on the program for the medical missions, not just medical missions, but also looking for ways that we can help, especially with the mental health. With mental health now, what I'm planning to do here is to do some mentorship. Like youth mentorship, advocacy, try
Hmm.
to mentor youths who have experienced substance abuse in their lives, and then they are struggling. So we're looking on how we can establish some partnerships with other healthcare organizations back home, and provide some of those services to the youth, even for free or at a discounted rate. So that's something that we are looking at doing.
Yes, Dr. Richard, let me bust this out. Let me bust you with this question. I know. Do you want to, first of all, let me extend my condolences here in the public to the loss in the family. Like they said, God gives and take. God has also blessed you in one hand. Actually, yes, you defended your doctorate degree months ago. The big graduation or the big party or the big celebration, let me call it that way, for your life achievement, if I might want to put it that way, is coming on soon. You want to share a little bit with me?
Seriously,
I put you on the spotlight, right?
yeah. Now I like to. Like, personally, I don't like being on the spotlight, right? So I
No,
like to
you already on the
like
your
simple
work is already on the
and
spotlight.
easy going
Yeah.
because, like I told you, I have never been hurt in my life like I was hurt when my brother died because
Hmm.
my brother died the same day that I was defending my doctorate. And I just say that, sometimes the Lord knows exactly what is happening because my defense was virtual. So as soon as I finished defending, and I had spoken to him that morning, as soon as I finished defending, then that call came in. As finished, and I was, signing out from the computer, and the call came in. So, and you can understand the mixed emotions at that moment. You go from being really excited,
Hmm.
being really
Down to a hole.
down and crying, and you cannot understand why. So and you're asking yourself like, why now? Right? So when I sit and I think about it, even celebrating is out of my mind. So I don't know. I just continue doing what I'm doing and just kind of let it go
Yeah.
for now. Lay low and see what the Lord has in store for me.
No, but I hope, if you look at everything God gives and take, I think the wonderful achievement, the wonderful work that you've done, if we were like, say, back home in those days, the community would celebrate for you. Will say, this is a wonderful achievement. This is somebody who have contributed. Because I remember, community even reported on some of the program that you were the kind of, you sponsor this program, maybe I want us to talk a little bit because some of the things that are a little bit kind of underreported, still related to this Mary Health of Africa Hospital, where people were able to go to hospital and their medication were paid for up to $1,000 or 1,000 francs CFA, and those that were delivery, they could deliver free of charge. That the cost of delivery, which was I think 12,000 at that time, was also paid for through that medical scheme that you were one of the very part of it that you contributed a lot of money towards that program.
Yeah, so we did that. We did that. LifeBridge did that for I think 2 years, and now because this is one thing you always want to have when you do something. Like when you provide for something, you want to be able to see exactly what it is that your investment, the return of investment, right? And
Hmm.
so sometimes there is missing reporting. It's misreporting, and therefore you're just providing the money, but you don't know exactly the impact that it
Yeah.
is causing. So if if we could get feedbacks, right?
Hmm.
Let's say if LifeBridge donates say 1 million francs CFA to subsidize
Healthcare services.
for those healthcare services. I think the least thing that LifeBridge or any person or any sponsor would expect is that at the end of the year, can there be some reporting back to them like, okay, you donated this, this is the amount of people that benefited from your gesture, right?
Hmm.
I think that would motivate you to give more. But if you donate and you don't get those, it's a simple report. Boom, this
Hmm.
is like a dashboard summary.
Yeah, snatch up.
It will motivate you. It will know that you are really making an impact. But if you do that and you don't get it, you're like, okay, what am I doing? Right? So I
Yeah,
think.
I try to get where you're going, and I think even in the first place, sometime, Dr. Richard, even to get people that, even to get an organization that you want to partner with, like Lokudu, that will be able to provide, say, services, an organization that you can actually say, okay, let me contribute money for you to go buy medication, or for you to maybe pay transportation for volunteer to go down to Fontem. Somebody will be able to do it, because that is also one of the challenges that we have also faced. Not to talk of, after doing the program, they actually produce a little bit of data that out of how much we receive, this how much we spend, and this how we spend them. You actually itemize it and make it public record, so that people can also see and become motivated. But I think, one of the first thing that you even want to donate money is the institution or an organization that is a little bit transparent.
Mhm.
And for that reason, I think that's why, I think at some point Lekudu was transparent to an extent that even motivated you to even say, okay, let me partner with you and give this money to you so that you can implement some of this program.
Yeah, I think Lukudo leadership, right? At the moment when
Hmm.
we came in, they had a dynamic leadership. I would not,
Hmm.
yes, I will always recognize that they had a dynamic leadership which was led by Terence Atem, and that's why I personally came in because I want to see what my dollars are doing, right?
Hmm.
I don't want
Yeah.
to just give my money and give it for giving sake. I want to be able to see that it is making an impact where it is destined to. And so that leadership was there. We came in and and I'm seeing what the current CEO is doing, and I think he's picking up from where Terence left, and we just pray that he will continue, and then when he puts the leadership uh you know baton down, somebody, the person that picks up, will still continue in the right way and even do better, because they say each successive generation should be better than the
The
previous,
previous one.
right? That's a mentality that every person, every parent should, because as a parent they say your children should be way better than you are,
Yeah.
and then your children should be way better than your children, right?
Hmm.
And if you have any deviation from that, I don't think that's what God intended for us to do. And if you have any bad intention, like I don't want to see my children go better than me,
Yeah.
that's
I
off.
think I think yes, I think you are actually very perfectly correct, and because people have been giving a kind of, suggestion that, oh, the Kudu have been doing this. Is it possible that they do it around here, where people can maybe you structure a calendar, so that you always have people that are visiting Cameroon at different time in interval, so that if you structure a calendar, somebody will know that, okay, this is a period where I can go in and volunteer. It fall within when I'm going for vacation and stuff like that. Then there is this. I know that there's already this monitoring, the 90-day continuous assessment. So the challenge now is, yes, it's become. It used to be that one day, 3 days is over, or a week. Then now the 90-day program step in. I believe. I hope it's still there. Then now the question is, how can we make from that 3 months to a full year, around the clock something?
Well, Dr. Ernest, I would personally, I would tell you that that is not feasible,
Mm-hmm.
because one, we have limited resources,
Yeah.
right?
Yeah.
Whether it is monetary, it's personnel, it's logistics, that aspect of it you cannot deny it. And so saying that you want to provide medical missions round the year, I'll tell you, it's not feasible, because one, those volunteers have their personal jobs, they have
Mm-hmm.
family, right? And so they need to work to be able to provide for those families. And you agree with me that here in the US, you have what? You have maybe uh, maybe 80 hours
Yeah.
in a year for vacation. So as soon as you exhaust those 80 hours, that's what that's 2 weeks of work. As
Yeah.
soon as
Yeah.
you exhaust it,
You don't have any
out of
idea.
time, bro. So you can't be, and even the resources to man those medical missions. Those are a lot of money. So I think
Mm.
that part of it is just to say that okay, we have at least a month, and we have made it such that it occurs every month, which is March, and
Mm-hmm.
therefore, if somebody really feels like volunteering, right, you can organize your schedule such that you have some free time during the
The month
month of
of
March, so that you can go and at least donate your time freely, because it feels good when you give freely, when you give without expecting a recompensation,
Mm-hmm.
right? Because you are actually impacting somebody's life. Like, look at the volunteers that left from here. They have families back home, and those families, somebody is taking care of them, but they are out there doing all this wonderful work. And so we should really recognize that and say it takes a heart to be able to volunteer, a
Yeah.
good heart to volunteer.
And that's quite true. I mean, this was a wonderful program. I remember, because I've been around the Kudu too for some time. I remember when the crisis when the crisis started, there was a committee. Was called the humanitarian committee that were only providing food under the leadership of Nkem Tongu. I think Dr. Forever Emon headed that department of the humanitarian. Then later on, Terence came in now and changed that. The structure was already kind of there. You just change it to become a health campaign that is go beyond providing food. Then Medicare, then people came in. I mean, I'm happy to have you this morning impromptu that you are here to share
Yeah.
your experience and your thought to the wonderful job that we see today. I mean, I remember that time in Chang, you were on camera. I was sitting here interview you, but now you see how it's now in our own area. I mean, this is marvelous. That we're glad that uh, the place is gradually opening up. People are beginning to at least give way for people to live their life, so that those that have not seen doctors, those that have not been having any healthcare services, can at least take the opportunity for the hardship that they have gone through to be able to receive Medicare that we are seeing today. Dr. Richard, I appreciate. I want to thank you so much.
And then just before I go, Dr. Ellis,
Yes.
I want to I
Hmm.
want to say I want to say one thing, right?
Yes.
When it comes to volunteering and
Hmm.
and doing all this wonderful work that people are on the ground doing, I just want to take this opportunity, right, to to send a message to every son and daughter of Lebanon, be it in the diaspora, be it at home, who has that will to say
Hmm.
it doesn't take much to make an impact in somebody's life. And that when people volunteer their time, their resources, and go down on to ground zero to provide these services, right?
Yeah.
Those of us who are back home with our families, who are back in the diaspora and didn't have the opportunity to go, the least we can do is say thank you to the people on the ground. Thank
Hmm.
you to those volunteers that have sacrificed. They've sacrificed, left their families, they've paid their flight ticket, and they are paying their accommodations, because after they leave that place, they're going to go back someplace else, and maybe they'll have to rent a hotel, they'll have to rent a car. So the least we can do is say thank you for your service, right? Thank you for your community service, and
Hmm.
and not have certain resentment, like, just say thank you, and because once you do that, right, the Lord the Lord listens to what you're saying,
Yeah.
and would probably touch somebody else's mind, and who would then say, I think I can do this too. So let's be appreciative. I'm just saying, let's be appreciative to
Appreciative,
the
yeah.
people down there who have sacrificed and are on the ground and doing all this wonderful work.
No, thank you. I think, yeah, I think the message is clear, at least,
Yeah,
especially when they come back, like, even those that leave Kumba, leave Boya, and travel to Fontem, they are also on duty that they have also taken off time from their own work to go
yeah,
spend those days there, to
yeah.
really
Our
go that way.
message goes to every volunteer, whether you
Hmm.
are in Chang, whether you are in Menji, whether you are where, whether you're in the diaspora in Kumba, Douala, you have left your base to
Hmm.
go and do this for free. It
Yeah.
is. It
Hmm.
is. Yes. That is humanitarian gestures.
Sure.
And we appreciate them and we pray for them that after this, the Lord is going to take them home safely, to their families. And
Yeah.
yeah,
No, I also thank you so much. Let's see. Maybe I think they just left the camera there for people to see what is going on. I think that is kind of a reception area where people you see the crowd is still there, even though it is already quarter past 3 p.m. because it is
mm,
10 a.m. Eastern Standard Time. I mean, around 3 p.m. towards evening, you still see those multitude of people out there. Really show, and this day two where
mm,
this event is taking place. Uh, Dr. Richard, I appreciate your time for coming here to share your thought and to advise our community. And I hope people listening to us, dear viewers, you pick one or two words from there, of course, and also be willing to contribute just in a little way, maybe even financially. If you're
mm.
not able to go, when the fundraising was going on, if you have $50, $100, give. You could buy maybe a cotton bulb. Maybe you could buy some spirit, some alcohol to use in the lab. You could buy maybe one medication. You never know what. Even buy a meal for somebody who is working there. It will go a long way. And I thank you too so much. Yeah,
Thank you, Dr. Ernest.
yeah. Dear viewers, that was it for this hair campaign program here. I don't know if Mary, are you there? Okay, probably Mary left, or maybe she's somewhere doing some other stuff. Dear viewers, we'll come to the end of this. We'll just say we should bring you these live images for what is happening at the. Okay, Mary, you are there. Till I pair my mic going. Yes, Mary, are you there?
Yes, sir.
Yes. So, Mary, what is going on now behind you? I think the image, I think the network is really steady now. I still see a lot of people.
Yes, behind me, yeah, it's already past 3 p.m., but then the population, what people will expect. They are
Yeah.
here waiting for their screening sessions in in that room directly behind me.
Mhm. Yes, okay. I see that there's a lot of people. I was just wondering that even at this hour in the evening, past 3 p.m., it's actually a kind of 20 minutes past 3. You will see a lot of people hanging out there. That means the population is really huge.
Exactly.
Yeah.
And I've been
So
here since 6 a.m.
mhm, I hope the personnel, I hope they will be able to attend to them. If not, maybe tomorrow, because tomorrow is definitely the last day.
Yes, but I want us to take note that there's a 90-day follow-up program for
Mhm.
this campaign.
Okay. Okay. For those that the doctor have referred them, that they'll continue to monitor them during those period.
Yes,
Okay,
exactly.
okay,
Exactly.
okay. Yes, Mary, I appreciate. Thank you so much for your volunteer and for the kind of work that you are there, providing us all this wonderful information and images. I also give credit to our able friend who has been assisting Dominic Nkem, our press photographer, and of course the principal also those who is providing us some of the technical live images to this broadcast. And Mary, I want to thank you so much, and I hope you stay safe down there. So, so yeah, Mary. So I know there's a lot of noise now, right there. So I will let you go for now. Then we'll always talk again after. So, dear viewers, we'll probably come to the end of this program. Yeah, it's been a wonderful time enjoying, seeing what is going on, just enjoying the humanitarian activity, the free services that people are doing, the reporting and everything, and what have you. Again, stay tuned to Gaza Media. Please share this link to family members, to loved ones, so that they can see the amazing work, and we'll call on, like Dr. Richard was saying, we'll call on more volunteers next time when this kind of program is coming on. Until then, we'll see you, and you have a wonderful week ahead.